Hello friends, welcome. Welcome to our live session this week, and we are delighted to have with us Dr. Subhash Gupta, who's the chairman at the Max Center of Liver Biliary Sciences at Max Super Speciality Hospital, Saket in New Delhi. So today he's going to talk to us about different liver diseases and their treatment options. Dr. Gupta, please.
Thank you very much for doing this for me. Facebook is an amazing way to connect with people and to talk about liver disease. That in general there are two kinds of liver disease. One is that is acquired by viruses, and that's a huge number now. And of course, there are diseases that are related to lifestyle or dietary discretion or alcohol consumption. So let's focus first on the viral aspects of liver disease. Here we have two main categories. One is which is waterborne, which is hepatitis A and hepatitis E, and then one which is bloodborne or sexually transmitted as well, such as hepatitis B and C. Luckily for us nowadays, for hepatitis B, there is an effective vaccine, and if people are vaccinated, then hepatitis B will not happen. And in the last few years, there's been an even greater development in treating or managing hepatitis C, which is effective antiviral therapy. So both these conditions can be eliminated from the face of the earth, maybe one by vaccination and the other by effective treatment. Then you come to the waterborne viral diseases of the liver, such as hepatitis A and E, and this is clearly related to sewage conditions, contamination of water by feces, because these are transmitted by what we call fecal-oral route. That means you take bacteria, ingest this bacteria, we pass it in your motion, your feces. This contaminates the drinking water of people, and then they fall ill. So hepatitis A and E, strangely, has still very much here. There's effective vaccination for hepatitis A, but for hepatitis E, at the moment there is no vaccination. And a lot of youngsters we find nowadays who live in their protected atmosphere of their home, where the parents take care of the water they drink, the food they eat, and when they go to hostels, then these precautions are not taken, and they often get hepatitis A and E. Ordinarily, hepatitis A and E are effectively mild diseases, but once in a while you end up with fulminant liver failure, and then of course many of them will recover on their own, but some of them will actually require a liver transplant operation, because of the deep jaundice, the brain is swollen and they end up in coma. So that's the viral type of liver diseases. But apart from this, there are other kinds of liver diseases, such as those related to alcohol consumption. And I must at this point stress on the damage that alcohol is causing to society. And youngsters are sort of drinking much more nowadays. Youngsters who are shy to drink in front of their parents are drinking openly with their parents. And it seems that alcohol is no longer taboo. And so a lot of youngsters, we end up getting liver disease. And obviously one cannot be very harsh and say that you cannot take alcohol, but at least if you do so, do it in moderation so that your liver doesn't get affected. And periodically, if you think you're drinking too much, then get your liver test done. Liver is a unique organ and it will regenerate if you just stop drinking altogether. So alcoholic liver disease is a big liver disease condition now, but clearly, if you don't drink alcohol, you can't get alcoholic liver disease. The other common disease of liver nowadays is what we call fatty liver, or liver disease related to sedentary lifestyle, disease related to side by side of diabetes and obesity. And this is something that, as you get fat deposition everywhere in the body, they get fat deposited in the liver as well. And then eventually, 10% of these people will end up with cirrhosis later on. And once you have cirrhosis, you can have development of liver cancer there. So obviously, this is again a preventable disease. Then you come to diseases of liver in children. Apart from the viral diseases, the children can get all viral diseases. But in youngsters, youngborn, there are two common conditions that we often see. One is biliary atresia, where the bile duct is not developed, and therefore they get jaundice. And then, but luckily, if they have a operation before they're 2 months of age, then this can be treated. And then, of course, you have what we call diseases of metabolic error. That means the body's metabolism is not right, and you get copper deposit, and you get Wilson's disease. So that's kind of sums up the entire gamut of liver diseases. And interestingly, more and more liver cancers are coming through, and therefore ultrasound, a good modality for looking at your liver, and a good ultrasound examination will rule out most ultrasound examination, and a liver function test will rule out problems of the liver. Thank you.
Okay. So, Doctor, we have some questions now that are commonly asked by people about liver diseases. So, the first one that we have here is there a way to slow or stop the liver damage or liver failure?
Of course there is. There is. I mean, as I said in my introductory few lines, that if you are not taking alcohol, you lead an active lifestyle, you keep your sugar under control, you don't drink too much alcohol. Obviously, you take vaccination for hepatitis B, and if you are unfortunate to have been detected with hepatitis C, take antiviral therapy. So obviously, your liver will be protected.
Right. So, and the second question is, what are the most common liver diseases, I think, that we have already covered, and what are the treatment options?
The treatment options, first and foremost, one point to remember here is that adult liver disease is mostly preventable. So there are many diseases which we cannot prevent ourselves from, but most of adult liver disease is preventable. For example, alcoholic liver disease, as you know, is completely preventable. Fatty liver, which is related to obesity, diabetes, sedentary lifestyle, again can be corrected by exercise and diet. Thirdly, if you have hepatitis B, there is effective treatment for that. You have hepatitis C, there is effective treatment for that. And then you have what we call waterborne diseases, such as hepatitis A and E, that can be eliminated if the sewage system is all right, or you take don't take raw food, you take well-cooked food, and you take water which is clean.
So what are the treatment options, doctor? What treatment procedures are there to?
The treatment is very simple. For most waterborne diseases, hepatitis A and E, they'll improve on their own. But of course, you need to see a specialist, because once in a while it can turn very, very dangerous. B and C, again, effective medical therapy. And as far as NASH, as we call it, non-alcoholic steatohepatitis, fatty liver disease, there again, you can there are drugs and medicines available.
The only cure?
Liver transplant is right at the end of the spectrum. It's very, very late treatment, in the sense that once your liver is failed, you're jaundiced, you have accumulation of water in the body, you have blood vomiting, you're swelling your legs, or your kidneys are affected, or your mind is not clear, you have what we call brain fog or coma, only then liver transplant comes. Or you have side development of liver cancer, only then liver transplantation comes into the treatment modality.
Okay. So, doctor, does hepatitis B or C always lead to liver failure? Or?
Yes. Hepatitis B can remain asymptomatic for many years, and but even if the liver disease is not there with hepatitis B, but you can get liver cancer just because hepatitis B is there. C usually will, if you live long enough and you have hepatitis C and you don't get treatment for it, it will manifest as advanced liver disease.
Doctor, can you tell us something about other treatment procedures that are there, like TIPS procedure and the TASTE procedure?
Yeah. There is apart from liver transplantation, which is changing the entire liver by a new one, there are other ways of treating liver disease. They have a kind of a limited role, but they are applicable in certain specific circumstances. For example, somebody has a liver function which is not bad. That means their bilirubin is normal. But the only problem they have is accumulation of water in their belly. And if that happens, then you can place a shunt within the liver radiologically. That means you puncture the vein in the neck, then you go through the heart into the liver vein, which drains blood away from it, from the vein, which you call the portal vein, and it put a metallic spring in it, and it connects the two, and then you divert blood flow from the liver into the systemic circulation. If that happens, then the water accumulation and the kidney failure that happens as a result of it will go away. TACE is done for people who have liver cancer, and liver cancer, obviously the best treatment is removing that cancerous part, but some people are too sick to have such a major surgery or do not want to have a transplant because they're too old, for example. Then we would block their blood supply so that liver cancer is taken care of. Apart from these two, there are other things as well, where we can put in an electrode within the liver and burn the cancerous part. That's another form of treatment. And before we go on to this kind of invasive treatment, as I say, there are, of course, if you have water accumulation, you can give water tablets, salt restriction, weight record, and then you can take care of the accumulation of water in the body.
Right. And finally, doctor, what is a MELD score? This is a term that we commonly come across in liver failure cases. So what is that?
MELD score was devised in the US. The full form is mortality from end-stage liver disease. What that means is that in liver transplantation, countries where rely mainly on what we call cadaveric donation, that somebody dies and then they donate their organs. And if that happens, then the liver, who do you give the liver to? It becomes a little bit of ethical question. So obviously the person who is the most likely to die immediately, he should be given the first liver, followed by the next liver to the one who's going to. So therefore, this score is calculated based on the bilirubin value, the INR value, and the creatinine value. So if a score is greater than 30, that you are in danger of dying within 3 months, 90% chances that you die within 3 months, and therefore if organ were to become available, then you would give it to that person. Unfortunately or unfortunately, depending on how you look at it, in India, most of transplant work is what we call living-related liver transplantations, where the organ donation is directed to individual. So the MELD score obviously is not that important because that score is mainly for allocation of a scarce resource.
Right. I think that covers everything. Thank you so much, friends.
Thank you.
Thank you, doctor, for your time.